Hello, my name is Becky and I'm a specialist gastroenterology dietitian at the Royal Derby Hospital. In this video, I'll be talking about salt in the diet and importantly, how you can reduce the amount of salt you eat. Most people in the UK eat too much salt. Although our bodies need some salt, the amount needed is very small. It is recommended that adults should eat less than 6 grams of salt a day, which is about a teaspoon, yet most people eat between 8 to 9 grams a day. You may be advised to eat less salt than this if you have a health condition that can be worsened with too much salt. Eating too much salt can cause health problems such as high blood pressure, which in turn increases the risk of heart disease and stroke. Salt also causes the body to hold on to fluids which can worsen symptoms such as edema and ascites. If you've been advised by your doctor to limit your fluid intake, eating too much salt can make this very difficult, especially as salt can make you feel more thirsty. Many foods contain some salt, but some contain a lot more than others. Approximately 75% of the salt we eat is found in processed foods. Therefore, the first piece of advice for reducing the amount of salt in your diet is to try and cook from fresh, reducing the amount of pre-prepared dishes and ready meals. For example, a shepherd's pie ready meal can contain up to 2.4 grams of salt versus one cooked from scratch, which contain as little as 1.3 grams per serving. To put this into perspective, one ready meal can give you up to 40% of your daily requirement and is the same as almost half a teaspoon of salt in one meal. Takeaways are also a source of high salt in the diet. Some takeaway meals can contain as much as 3 grams of salt per portion, which is as much as half of your daily recommendation. We recommend that you limit the amount of takeaway meals you have if you are trying to cut down on your salt intake. However, when choosing things like ready meals, you can make better choices by looking at the nutrition label. Food labels often show the salt content per 100 grams. Using a label guide can help you to identify salt content by a traffic light system, showing red for high, yellow for medium, and green for low. A high salt product has more than 1.5 grams, a medium salt product has between 0.3 and 1.5 grams, and a lower salt product has less than 0.3 grams per 100 grams. Remember, it is important to consider the overall salt content of the portion size of your meal. As a general guide, aim to keep a main meal to less than 2 grams of salt per portion and a snack food less than 0.5 grams of salt per portion. Salt can be listed as sodium on the nutritional information. To convert this into grams of salt, multiply the number by 2.5. Finding options with no added salt is also a good idea, but do still check the label as it can be misleading with some of these foods still being higher than recommended amounts. The websites Action on Salt or the Food Standards Agency provide a handy label guide that you can use to help when starting to read labels. There are lots of common foods that can be high in salt. I will now talk through some of these foods and alternatives that are a better choice. Meat and meat products such as bacon, cured meats, sausages, tinned meat like corned beef or tinned ham, pâté, meat pies and burgers are all generally high in salt. Better alternatives include low salt bacon, unsmoked ham, plain meat or chicken, and homemade meat pies. Fish products high in salt include all smoked fish, tinned fish in brine such as tuna or sardines, fish pâté or paste. Instead, choose fresh fish or tinned fish in spring water or oil. A lot of cheeses have salt added in the process of making them, such as cheddar, smoked cheese or processed cheese like cheese slices or cheese spread. Also be aware of salted butters and spreads. As a replacement, look for unsmoked and unprocessed cheeses or things like cottage cheese or cream cheese. A useful tip is to grate your favourite cheese so that you are likely to use less than if you were to slice it. Unsalted or lightly salted butter or spread is a better choice. Salt is often added as flavouring or preservative to a lot of sauces, condiments and snack foods, as well as stock cubes, tinned soups, instant noodles and tinned beans and vegetables. Be cautious when using condiments and dressings and try to look for unsalted snack products where possible and choose tinned vegetables in unsalted water. When you are cooking yourself, try to avoid adding salt or cut down to use only small amounts. Using herbs and spices, lemon or lime juice, onion, garlic or chilli can be an alternative to salt in recipes. The type of salt you use does not change our recommendations. There are many types of salt available to buy, often with health claims that make it seem like they may be a healthier alternative. All types of salt, including rock salt, kosher salt, sea salt, pink salt and standard table salt, all count towards your overall intake. We also do not recommend salt substitute products for everyone, as these can contain high levels of potassium, which may not be suitable for you. Finally, the last piece of advice to reduce salt intake is avoid adding salt at the table. It is often a habit that we can learn to break. Our taste buds adapt surprisingly quickly to having less salt added to foods. Within a month of reducing the salt in your diet, you won't be able to tell the difference. For more information on reducing salt in your diet and label reading guides, look at Action on Salt or the Food Standards Agency websites, as well as British Dietetic Association and NHS pages.